Hello everyone, welcome to this live session of Ultra Heal Homeopathy. Today we are going to discuss a case of Crohn's disease and its treatment with homeopathy. Crohn's disease is a chronic inflammatory bowel disease, also known as IBD. It is characterized by chronic inflammation of the mucous lining of the GI tract leading to ulcerations. It can affect any part of the GI tract from mouth to anus. Any part of the intestine can be involved. Mostly the parts of colon and small intestine are affected. The patient symptoms are pain in abdomen, indigestion, flatulence, burning in GI tract, diarrhea, severe diarrhea, frequency may be 6 to 7 times or maybe more. Pain in joints and muscles, weakness and emaciation due to loss of appetite is there. Severe patient is severely malnourished, very weak in appearance. Crohn's disease is a systemic disease, so it involves the whole body. You can see here in the inflammatory process in the parts of colon and small intestine. The parts of colon affected are ascending colon, transverse colon, and ileum is affected. The inflammatory process, chronic inflammatory process is going on in the mucous linings, leading to ulcerations there. The deep ulcers form, leading to pain and tenderness. The muscles of the mucous membrane of the intestine hypertrophy and forms deep fissures there. You can see here in the diagram and compare it with the healthy mucous linings. You can see normal healthy mucous linings, and in Crohn's disease the muscles hypertrophy and deep fissures form in the mucous linings along with the cobblestoning appearance. And here you see an ulcerative colitis also, ulcers form in the mucosa. Due to the chronic inflammatory process, the whole of the mucous linings of the intestine gets damaged. Now this is a case of a 26-year-old male patient. He came with the complaint of pain and tenderness in the right iliac region since last 1 to 2 months. Pain radiates from the right side of the abdomen to the back, and there is burning in the whole GI tract from throat to anus. There is desire for cold drinks which relieves the burning. There is constant urge to pass the stools. This is aggravated after eating and during the morning hours. The frequency of the stools is 6 to 7 times in a day. The stools are followed by pain and tenesmus in abdomen along with severe burning in the rectum. Very offensive stools are there. There is lot of flatulence in abdomen. Feels like there is something moving live inside the abdomen. The patient is unable to expel the flatus out. The abdomen feels very heavy and tender. It is so much distended. There is no appetite. Patient is very weak and emaciated. Obstruction in the throat, as if feels as if something is stuck in the throat along with the burning. The complaints started since last 3 to 4 years, and there is much aggravation since last 1 to 2 months. There is headache associated with GI disturbance. The flatulence ascends to the head and causes pain there. Abdomen is very distended along with, due to the flatus. There is stiffness in the joints also, which is aggravated in the morning hours. The case was analyzed using the repertory, and the main genres and the pathological rubrics taken were abdomen enterocolitis, abdomen intestines ulcerations, abdomen colic pains ileocecal, abdomen colic pains type of pain bruised, abdomen colic pains colicky crampy constricting, abdomen colic pains concomitant abdomen swollen like a pad, abdomen colic pains concomitants backache, abdomen colic pains concomitants cramps in calves muscles, abdomen colic pains concomitants urging to stools, abdomen colic pains concomitants scanty stools, fetus without relief, abdomen flatulency, flatus, incarcerated in flexures, abdomen flatulence, offensive per anno, abdomen flatulency, hardness, abdomen flatulency, jumping as of a live thing, abdomen flatulency, sensitive, tender to touch, to pressure, abdomen, anus, rectum, burning, smarting, heat before and during stools, abdomen, headache causing gastrointestinal disturbance, stomach, appetite, craving cold drinks. You can see here the rubrics taken for the analyzing of case. All the main pathological journals were taken here along with some general symptoms. The case was analyzed and the remedy which came out prominently was Socotrine aloes. So Socotrine aloes was prescribed to the patient, and after taking the dose of aloes, he felt much better. A loud eructation was followed with the dose and the patient got relief. So here you see the effect of homeopathic medicines even in advanced pathological conditions. Homeopathy is helpful. The treatment of the patient continued for almost 6 months and he got rid of all his symptoms. The patient was cured as a whole and there was no reappearance of the symptoms after homeopathic treatment. So like my page for more such updates. So homeopathy heals in the whole, as a whole. Thank you.